Hi, I'm Mary Colbert. Welcome to Dr. Colbert's Divine Health podcast and YouTube channel. And we appreciate you tuning in and watching this. You are going to learn so much information. We are going to be talking about thyroid. So Don, take it away.
Well, Mary, first of all, thyroid, so many Americans have sluggish thyroids, yet they're not being diagnosed by their physician. Only 2% of Americans have hypothyroidism or low thyroid functioning, according to the stats and according to medicine.
Okay, how many?
2%, 2 out of 100.
2%.
2 out of 100. But they say when people get older, as many as 10% of older people over 60 can have, subclinical hypothyroidism or just mild hypothyroidism. 10% that are over 60.
Okay, Don, you have seen well over, you've been practicing as a...
35 years.
35 years.
Mary, 50% of my patients over 50 have hypothyroid or sluggish thyroid function.
Okay, 50% of
my patients.
Of your patients.
Yes.
And yet, statistic is saying 2%.
Yeah, there's no way.
Does that tell you something's wrong?
Well, they come in on all these meds, but then I'm able to get most of my patients off a lot of their meds, and I put them on these bioidentical hormones, including the active form of the thyroid hormone. Active form. Now, let's just talk about the symptoms. Now, realize most low thyroid is due to an autoimmune disease called Hashimoto's thyroiditis. It's a autoimmune disease of the thyroid, and we now know that many foods can affect and lead to that, such as gluten, as well as soy. Those are two of the main ones, as well as corn and dairy. And those are the four main foods people eat. But these can set you up for Hashimoto's thyroiditis, as well as too much iodine. Yes, we need a little iodine, about 150 micrograms a day. But high-dose iodine can actually lead to Hashimoto's thyroiditis. It can make the thyroid go haywire.
Do you think that GMO foods are affecting that?
Oh, absolutely. I think they are. They're affecting the gut. They're causing leaky gut. Genetically modified foods. They're killing off the good bacteria, and they're setting us up for autoimmune disease. In fact, most all autoimmune diseases start with a leaky gut. And I'll talk about that in my Gut Zone book.
Wow. So on the labels of a lot of food right now, you'll see... Sure. GMO is in the ingredient of this.
And realize most all corn, which is a hypothyroid food, as well as soy. Which over 9% of soy is genetically 90%. Modified. And it just so happens those two foods are mostly genetically modified, and they're thyroid-killing foods, or it inflames the thyroid, creates leaky gut.
Yeah.
So, yes, but let's talk about the symptoms of low thyroid. I can usually enter a room, shake hands with a person, look at their temperature, and when they have cold hands and cold feet, usually they have hypo or subclinical hypothyroidism.
And their temperature is usually around 97?
Usually 97.8 or less than 98. And so I can look at those two things and usually tell, but then these people are tired, they're exhausted. The two key hormones that boost energy are thyroid, the active form of thyroid, and testosterone. And it's amazing when I use these two hormones, along with we can give them natural energy boosters like NAD and green tea extract and adrenal extract, and how when we put them on those 5 things, the two hormones, testosterone, active form of thyroid, and then the green tea extract, the NAD, which is it's a cofactor to boost energy, and then adrenal desiccated. It's amazing how their energy comes back with those 5 things. Now, again, we're talking about energy. The inactive form of thyroid, which is synthroid or levothyroxine, that most doctors prescribe for low thyroid, will help with TSH. And again, low thyroid is diagnosed by most doctors by the thyroid-stimulating hormone, which is a pituitary hormone. If that hormone is 4.5 or greater, that's microunits per liter, then that is low thyroid. The higher that number goes, the lower the thyroid functions. But the best number to tell you, or the best test to tell you if you got low thyroid, I believe, is the free T3 level, or the active form of T3 thyroid hormone.
So when you get a blood test, you need to make sure that your doctor does
The free T3 level.
Free T3.
Now, on every patient that comes in to see me, I check their free T3 level. T3 is the active form of the thyroid hormone. If that level is low, less than 2.5, they've got either hypo or sluggish thyroid. And they'll have the cold hands, the cold feet, and all the symptoms I'm about to talk about. So again, we look at that number now. Most doctors prescribe Synthroid or levothyroxine, which is the inactive form of thyroid, which helps lower the TSH value to normal, but it doesn't help the symptoms. It doesn't help the cold hands, the cold feet, the energy, the weight gain, the dry skin, the brittle hair, the loss of the lateral eyebrow. These are all symptoms of low thyroid that the Synthroid doesn't help. And so many people come in to see me, and their doctors or endocrinologists have put them on Synthroid. They have all the symptoms of low thyroid. Let me just go through them real quick. And then what I have to do is I have to put them on either a low dose of liothyronine, the active form of T3, or the natural desiccated thyroid. And I do this every day in my practice. So here are the symptoms of low thyroid: cold hands, cold feet, low body temperature, dry skin, especially the hands, the feet, the elbows, and the knees, and they get those cracked heels. If you have the cracked heels, usually your thyroid's sluggish or low. They also get fatigue, but a severe fatigue, the weight gain, and also some edema, usually it could be in their hands, their feet, their face, or their eyes kind of bulge out. They get these bags under their eyes. That's a sign of sluggish or low thyroid. They get a puffy face, a hoarse, husky voice, hair loss. Their hair breaks and thins out. They get what I call thyroid hair, that fine, wispy thyroid hair. And women hate it because they blow dry it just as fine and wispy. And they wonder what's going on. They get the brittle fingernails and toenails. Well, literally, their fingernails will break. They're thin and brittle.
Does this happen for men?
Oh, yes, absolutely. I see it in men all the time. But for women, when I put them on the active form of thyroid, it's amazing how their nails, fingernails, toenails get thicker, and especially when I put them on our collagen. 2 scoops a day of collagen with the active form of thyroid, either the natural desiccated thyroid, such as NP Thyroid. Ask your doctor for that one. Now, if you're over 70 or 75, you may have to use just the Synthroid with low-dose liothyronine or T3, because I don't want the natural desiccated thyroid to be too high and make your heart rate increase, because thyroid speeds your heart rate up. That's why we're real cautious in those patients that are over 70, especially over 80 with the natural desiccated thyroid.
I didn't bring our collagen because I didn't know you were going to bring in, but we should have.
We should have.
We have chocolate and vanilla, and we're coming out with a new flavor that tastes like Almond Joy. It's chocolate coconut, and I got to tell you, it's my favorite.
Well, you know what? I stopped coffee for the last week. I just drank green tea, and I always put our chocolate collagen in my coffee. And I said, I've got some joint aches in my knees. I just did squats last week. And I said, I've forgotten to take my collagen. So I took 2 scoops a day, and the knee pain totally gone. But it's amazing how that works. It does work.
Our collagen, and not all collagen is equal. I'm just telling you, this is Dr. Colbert's.
It's our chicken collagen, and it works. So many patients told me they've tried other collagen, didn't help their joints. Once they switched to mine, and the magic number for joints is 2 scoops a day. It's amazing. I used to put it in my coffee. Now I'm putting it in my green tea. I drink less coffee and more green tea. Yeah,
so definitely make a note of that. If you say, I tried collagen, it didn't work, you didn't try our collagen.
Now, people with low thyroid or sluggish thyroid get brain fog. It is amazing how thyroid turns the brain on, and they're more prone to depression. I had one patient, he's a doctor, he had severe depression. The only thing that pulled him out of depression was the natural thyroid, the liothyronine, the T3. Yeah. It is amazing how T3 pulls so many people out of depression, even our thyroid zone. Our thyroid zone will boost free T3 levels, and have helped a lot of patients with these symptoms.
I remember one lady standing at the counter that came in to see you. She says, Mary, I take 4 of these a day. I used to be on antidepressants and used to take other things. And she goes, when Dr. Colbert balanced my thyroid with the medicine that she takes, the natural thyroid, she goes, I supplemented it with your thyroid zone.
Right.
And she goes, I take 4 of these a day, and I don't do SAMI, and she was just telling me her story of things. She quit taking everything. She goes, I have such an optimistic feel and an outlook, and I was like, wow, I didn't know it had that kind of effect.
Right.
But she stood there just swearing it made a difference to her.
Well, also, people with low thyroid or sluggish thyroid are real prone to constipation. Remember, the thyroid increases peristalsis of the colon, which helps with constipation, especially when you combine it with 3 things, guys, just 3 things. Number 1, water. You need at least 1.5 quarts of water a day. Number 2, fiber. I think our fiber is the best. It's Fiber Zone. It also has the prebiotics in it, but it tastes delicious. You used to hate fiber. Now you take it.
I know, and we have
take it twice a
2
day.
flavors now. We have a berry and a lemon lime. That's now
both
coming
are
out.
delicious. Okay.
Yeah.
And the third thing is magnesium. Most everyone needs at least 320 to 400 milligrams of magnesium a day. It really helps the bowels. When you put those 4 components together, especially the thyroid, it's amazing how the bowels are regular every day. Usually after every meal, you should have a bowel movement.
The best thing, and it works. Boy, does it work. But one of the best things I found with the Fiber Zone is how it curbs your appetite.
Especially at night.
At night, when I would do the fiber at night, I have no desire to snack. None.
You're
It's gone.
right. And that's what I do. What I do is I take my Fiber Zone at night with water, and I'm still in the fasting zone. And then in the morning, instead of coffee, now I used to do coffee. You can still have coffee, but I started developing a little thumb pain, so I cut my coffee out.
That was his.
That was my indicator that, hey, I'm drinking too much coffee. Now I'll drink green tea, and I can fast now 16 hours a night. It's much easier to fast.
You have never fasted like that.
Yeah,
never. That's
I know,
amazing.
but I'm able to do it now with my green tea. And I make my green tea, I combine jasmine green tea with cinnamon, which cinnamon boosts your brain-derived neurotrophic factor. And I use a lemon tea. So I put all 3 in there, and it tastes delicious.
He's a developer, you know. He researches.
I've got all these tea bags I've done, but it works great.
And he does it on tea, too.
Okay, now those with low thyroid, listen to the diseases you sign up with. A low thyroid or sluggish thyroid, you're more prone to heart disease, high blood pressure, high cholesterol. It is amazing when I put patients on thyroid how it drops that cholesterol level. It is absolutely amazing.
Wow.
As well as they're more prone to diabetes, depression, which we talked about, chronic fatigue. Thyroid is, especially the active form of thyroid, is the energy hormone, as well as helps with memory loss. It helps prevent dementia, obesity. Oh, this is important for younger women. Infertility, miscarriages, and menstrual irregularities. I have had so many young women I put on the natural thyroid, such as NP Thyroid, that are able to get pregnant. And so many women come in the office just brag and say, Dr. Colbert got me pregnant. And Mary says, no, he didn't. It's the hormones he prescribed. It's the thyroid.
I've been in the airport where women I didn't know they'd come in and go up and say, oh, I just love your husband. I got pregnant because of him. And I'm like, you want to clarify that? So you do progesterone, would be one thing you would do. You'd put them on progesterone, and then you would balance their thyroid. And it's amazing how many people who are miscarriaging.
Right.
And even OBGYN doctors don't know this.
But one critical thing I did is I put them on the active forms of the B vitamins because many of them, that especially miscarriage, had a mutation in the MTHFR gene, and our Brain Zone Basic has all those B vitamins, the active forms in there. You can take 2 twice a day or just 2 in the morning if you have the minor mutation. And that along with the natural thyroid, NP Thyroid usually, or in our Thyroid Zone if it's mild.
Are you talking about our multivitamin?
No, I'm talking about our Brain Zone Basic.
Has that boost.
It has that, yes.
Okay.
It literally will support and lower that homocysteine level. And those patients that have high homocysteine, have the MTHFR gene mutation, are more prone to miscarriage. Brain Zone Basic will help tremendous in that. And along with the natural progesterone, either the cream or the pill.
You may have to play this over and over again to get all the information he just gave. I know that's a lot.
But we've treated, and we've helped so many women that are infertile. But you got to catch it before you're 50, because when you stop producing eggs, and then you have to have a creative miracle. Okay, now also it helps with memory loss. It helps, again, all of these things natural thyroid does for you. Now what happened is back in the 1950s, Synthroid Synthroid is the most common thyroid. Many years it'd be the #1 prescribed drug in America, Synthroid or levothyroxine. same thing. That's the inactive form of thyroid. And back in the 1950s, natural desiccated thyroid was the number one thyroid prescribed. So they started a brilliant campaign they hired a renowned researcher to study natural desiccated thyroid and to discredit it and to say how Synthroid was superior. So what the researcher found, the researcher found that the Synthroid is not superior, but the natural desiccated thyroid was superior to the Synthroid. And so what they did is they discredited this researcher, and so they went to the endocrinologist, the primary care doctors, and they convinced them that Synthroid was the best thyroid hormone. Jeez. And so most all endocrinologists and primary care doctors, internists they switched from the natural desiccated thyroid to the Synthroid. And so then later, when she got the research and she found out that, in fact, the natural desiccated thyroid was superior to the Synthroid, they tried to discredit her, but eventually it came out, but then it was too late, and they had already been prescribing the Synthroid, so they stopped prescribing the natural desiccated thyroid.
I hope you just heard what he just said. Someone with legitimate research proving,
and it's in my book. I talk about this in the book. Yes,
proving that the natural the thyroid was better, and yet they got sabotaged. A lie has told that it moved all these endocrinologists prescribing the wrong, really the wrong.
Right.
And now the truth finally has come back out. But they get in that rut.
Now let's explain why. But let's explain why.
They get in a rut of prescribing what they are used to,
right,
and they won't get out of that rut. And
now what's happened, though, is Synthroid is easy. It's simple. It's synthetic.
Yeah.
It's man-made. And they have just T4, which is the inactive form of thyroid hormone. Now, whereas the natural desiccated thyroid comes from a pig's thyroid. It matches the human thyroid. It has a 4-to-1 ratio of T4 to T3. Wow. T3 is the active form of the thyroid hormone, which Synthroid has none of that. The active form of the thyroid hormone is what affects your energy. It helps you with cold hands and cold feet and brain fog and loss of hair and swelling and constipation, all the problems with low thyroid that Synthroid doesn't treat, it treats. And so yet the doctors are not prescribing it. So many people that come in and see me, they say, oh, I see the top endocrinologist. I said, well, here, let's keep you on your Synthroid. I don't want to upset them. I'm treating their doctors so they won't get upset and fire the patient. Or else the doctor.
The doctor. He's not treating the patient.
Well, if I don't, the doctor will fire the patient. I've had that happen. So I said, okay, let me do this. Let's put you on a little active form of the thyroid, liothyronine. Let's put you on 5 micrograms twice a day, a low dose, in the morning and at night with your Synthroid, and all of a sudden they do great. They go to their endocrinologist, and their numbers are perfect, and they're so happy, and the patient's happy, the doctor's happy, and I'm happy, and the patient's losing weight. All their cold hands, cold feet have gone. They're having a bowel movement every day. Their brain fog's gone. Their energy's come forth, and they feel amazing. Well, the NP Thyroid, or the natural desiccated thyroid, contains the right proportion of T4 to T3, 4-to-1 ratio, as our thyroids, but it also contains T1, T2, calcitonin, and iodine, all cofactors that we need for our thyroid. So it's superior unless you're allergic to pork. If you're allergic to pork, or I have Jews that will not have any pork and they say, I can't, then I'll use a little of the T4. I'll use, 3/4 T4, 1/4 T3, which is the same ratio that we normally use, the NP Thyroid, okay?
Listen, do yourself a favor and share this video with your doctors. Tell your doctors just nicely, say, would you just Google this doctor and watch this video? It's 30 minutes. You'd be shocked. If you're a doctor and you're watching this and you're like, this, you've never heard this? How you don't know what we're talking about? You take this information and research it, and you're going to find out you have been lied to and you have been manipulated. And so you take this information and research it yourself. Give Don's book. He's got the data in here. So you can go in and you can research this, and you're going to be upset. I promise you, doctor, you're watching this and you don't know it, you're going to get upset. And I hope you do. and spread it to your other colleagues.
No.
Because, Don, this is nuts.
Right now.
It's nuts what's happening.
It is. But, I told you the leading cause of low thyroid in this country is Hashimoto's thyroiditis and autoimmune disease. Other causes of low thyroid include thyroiditis, but also adrenal fatigue. So many people with adrenal fatigue have sluggish thyroid, or they have too much of the reverse T3. And people with chronic disease have too much reverse T3 that blocks the thyroid T3 from entering into the cell. So there's many different causes. Iodine is also important for the thyroid. Some people are using mega doses of iodine. And like I say, that can actually trigger Hashimoto's thyroiditis. So we need approximately 150 micrograms, that's a little teeny bit, of iodine per day. It's in my thyroid zone. And so again, multivitamin, the daily value should be 150 micrograms of iodine. Also, salt, a quarter teaspoon of salt, iodized salt, contains 67.5 milligrams of iodine. So you can have just a half teaspoon of salt.
Just with your iodine salt.
Yeah, so that's fine. You don't need a ton of iodine. Some people I find take a lot, and I've seen so many people take too much iodine and develop hyperthyroid or Hashimoto's thyroiditis from it. So just be cautious.
It's a mistake to try to treat yourself, though, and diagnose yourself. You do need to get with someone who knows how to balance this out.
Now,
that's for sure.
The most common worldwide cause of low thyroid is iodine deficiency, but we rarely see that in this country due to the iodized salt. Foods that contain iodine are mainly fish, as well as shellfish, seaweed, as well as eggs and dairy and chicken. But again, the fish and the seaweed have more iodine in shellfish than any other food. But iodized salt, you're getting plenty. But it's also in our thyroid zone. We have in our multivitamin. If you take 300 micrograms, you're fine. That's 150 in each of those products.
So even if you have a healthy thyroid, this is not a bad product to take.
Absolutely.
It's a great supplement.
Well, it's going to so many people have sluggish thyroid. That's when that free T3 is like 2.5, 2.7 or lower, and they just don't have the zip they used to have. This will help to boost and support a healthy free, the thyroid, the free T3 level, which is your active thyroid that gives you energy. It helps with brain fog. It helps with that, dry skin. It also helps with the constipation and the fingernails.
And what do you recommend?
3 a day or 2 twice a day. A lot of people like 2 twice a day.
Yeah,
but don't take it with your thyroid medication.
Okay, that's important.
And so a lot of my patients will take the thyroid. See, thyroid hormone doesn't play well with other meds. It has to be taken by itself, not with coffee, with water. And I take the NP Thyroid, 90 milligrams. You take the 60 milligrams. And so just recently, I just checked her thyroid level, and it was a little on the high side at 5 point something. So I lowered her from 90 to 60, and that's perfect for her. And so that's working good, whereas I need the 90 milligrams. A lot of my patients, most patients are usually between 60 and 90 milligrams of NP Thyroid. You can also use Armour Thyroid, which is a natural desiccated thyroid. So again, the thyroid is one of the key things for energy. And for those people that are just not quite there, like for you, if you need a little extra boost, I would put you on the thyroid zone 2 in the morning and 2 at noon. And it'll help to get you
2 in the morning and 2 at noon. Don't do this at night.
No, you'll have too much energy at night.
And it might interfere with your sleep.
Right.
Okay, so that's an important factor. So
too much energy, and that's you don't want that at night. You want it during the day. So I love it in the morning and at noon. Now, like I say, a lot of patients, I see elderly patients that come in on Synthroid from their primary care doctor, their internist, or their endocrinologist. They're on that Synthroid or levothyroxine, but they have every one of those symptoms of low thyroid.
You know what, Don?
They don't understand it.
What Don does, and this is so important, is he treats the patient on how they feel. How are you feeling?
But also I check their labs and I optimize their numbers.
No, but even from that, you balance it out with how they feel. Because if the labs are just okay, but they tell you they feel great, you just keep them going like that. But if they come in, I'm depressed, I'm sluggish, I don't have energy, whatever, then you work with them until they are feeling like they know they need to.
And I tweak it. And I'll tweak it with natural desiccated thyroid or allowothyronine and thyroid zone.
I know. I just love that. It's about how you feel. You know, you want to feel
We found the keys.
good.
It's taken us decades to learn it. Now, the other thyroid problem we see rarely is hyper or hyperfunctioning thyroid, which is is usually caused from Graves' disease, which is hyperthyroid, or it could be from a toxic or a hot nodule in the thyroid, or it could be from...
Now, those people are the ones that are real thin. And,
yes, they're the ones that lose weight.
They can eat whenever they want.
Yeah.
And
well, the heart, they're producing too much thyroid. It's usually an autoimmune disease called Graves'. Or it could be from a hyperfunctioning nodule of the thyroid or from thyroiditis. But these people lose weight easily without trying.
Yeah.
Their heart's beating fast, usually over 100. They get palpitations or their heart pounds.
So what do you do for them?
They're sweating all the time. They have tremors. Well, what the doctors do, and this is medicine, usually they give you radioactive iodine. They nuke your thyroid, where then you have to be on, then they put you on Synthro the rest of your life, and you blow up like a balloon, and you're exhausted the rest of your life and constipated, and you're always cold hands, cold feet. What I do is I put them first on a beta blocker to lower their thyroid, to protect their heart from high output cardiac failure, heart failure. So I put them on CoQ10. I put them on a beta blocker. A beta blocker lowers their heart rate. The CoQ10 protects their heart from heart failure. I put them on a little tapazole, which is a thyroid blocker, and then I monitor that. I check their thyroid levels every month until I get it down to normal with the tapazole. I then put them on low-dose naltrexone, about 4.5 to 7.5 milligrams. Start low, start at 3 milligrams, and work them up to 4.5. And the naltrexone will help to reset their autoimmune disease, their Graves' disease, and it'll eventually bring it down. And then I'll put them on a supplement called Moducare. I've been using this for 30 years in hyperthyroid patients. Moducare, you get online, 2 twice a day, empty stomach, and those together are absolutely amazing. I've fixed so many patients and reset their thyroid. If you catch it early enough. If they've had it for years, sometimes you can't. But those are the key things I've done to reset hyperthyroid. And again, the diet's important. You got to cut those foods out that fuel the thyroid, make it go hyper, that are autoimmune causing foods. The gluten is the worst, as well as the soy. Then also dairy and corn can affect the genetically modified foods like we talked about earlier. But that's it in a nutshell.
Now, I hope you noticed he was just spewing that out from here. I tell you.
Been doing this for years.
I know, but your numbers and your names, and I mean, I can meet someone and can't remember their name.
But Mary, hyperthyroid's rare. It only occurs in 1% of people, 1 out of 100. So it's more rare. Hypo is much more.
Yeah, but if you're one of that 100, it's a big deal.
We can fix it usually if we catch it soon enough.
Okay. Well, listen, you need to get a hold of his book, The Hormone Zone. We have way more information about other hormones. We didn't even get to the adrenals. That's
or the growth hormone. Oh, my goodness.
Growth hormone.
We'll do shows on it later.
The other hormones.
Well, pregnenolone, DHEA, cortisol,
all these other
melatonin.
Those are all
lots.
These amazing, we are hormones. We are hormones.
The hormones are the spark plugs of life. And again, that's why get the Hormone Zone book. And again, for thyroid, consider the Healthy Thyroid Zone supplement. It works amazing.
Go to our website and you can get a hold of our supplements, divinehealth.com. And we have specials from time to time, and we're constantly bringing new products out. We are trying desperately to make Divine Health your one-stop shop for all your nutritional needs and supplements. If we don't have it, you probably don't need it.
But when you do purchase a Divine Health product, you are supporting this podcast and YouTube channel. So become a partner with us. And then we want to get this word out, and we want you to end this race strong. And we'll all see each other for eternity in glory. So praise God.
And let us hear your stories and your turnarounds. We love to hear examples of things that you have done and applying what you have learned from Dr. Colbert. And it just encourages other people to know that this is real and it really does work. God bless you. We pray for you, and we wish above all things that you prosper and be in health. God bless you.
God bless.